Hey everyone, today I'm going to talk about something that's a little different in spine surgery. It's called the transition zone. And it's between what we're doing to take care of our spines when we're having achy neck or back pain with regards to physical therapy, exercise strengthening, and maybe even pain management, injections, blocks, or perhaps even minimally invasive surgery like releasing nerves. These are minor things that we usually do on one side. And on the other side of this zone is where we're doing the bigger surgeries. And a lot of doctors in spine surgery still do a lot of fusion, which is a bigger operation. People are afraid of fusion. It restricts motion and mobility. So there is a whole zone in the middle that we're not really talking about. I call it the transition zone. So in this zone, when we've run out of things to do with physical therapy and minimally invasive surgical techniques that we can do to help preserve motion and mobility before and hopefully preventing the need to get to the surgery fusion zone, which is much more restricting. Now, sometimes we have to do a fusion. I have a fusion in my neck at cervical 6-7, the bottom, but I have an artificial disc on top. So an artificial disc is an example of a surgical technology that's in the transition zone. Another one is a device that's very popular called Coflex. And this is a U-shaped device that goes between the spinous bones in the back. It takes pressure off arthritic joints in the spine, but still springs. I don't know if you can see that moving, but this allows motion. So before you get to the final fusion stage, this is a device that can be implanted to protect the degeneration and keep you mobile and functional and reducing the pain. So I want you to keep those things in mind and ask your doctor about transition zone devices or motion-sparing devices. Inevitably, you may end up having a fusion someday. I don't know. I had to. So there's lots of in-betweens. And I just wanted you to be aware of those. And next time we'll talk about artificial discs in detail. Have a great day.